It's buyout day. The horses have just arrived. We're actually rescuing an entire semi-truck of horses today. There's 26 on there, I believe, 21 regular horses and 5 draft horses. And they're getting the paperwork done real quick. We're gonna get up to quarantine. We're gonna get them unloaded. Dr. Lydia is out in California actually doing some training. So it's Dr. Gina on staff today. And we're gonna get these horses all the help they need. So come with that journey. It's the Almost Live Buyout Intake and Assessment. The team is getting everything unloaded. There's the x-ray. We have all the medical equipment we need to do an assessment and evaluate and treat these animals as they come off the trailer. So looking forward to it. Can't wait to see who we rescued today. Well, so we got pizza. Pizza showed up before the horses. They're down there. They're navigating their way up here. So people might be grabbing a bite to eat before we get going. So we had a bit of a situation where the truck and trailer couldn't actually get through the back out of the driveway and up to quarantine. So they're just backing up our actual alleyway between all the adoptable horses, and he's going to make the corner and he's going to back up to quarantine, or almost to quarantine. So pretty interesting, but we're getting it done, and these horses are coming off really soon. Alrighty, they're going to be coming off. A whole semi-truckload.
Sometimes people do not want to be filmed, and in those cases we aren't able to film and show you everything, but the horses did unload off the trailer safely, and now they're ready to have their intake done.
Look at those front legs. That is just so sad. Like, it's a genetic deformity as best I can tell. And
I'm hopeful that there's nothing majorly systemic wrong with a few of them.
Come on, sir.
you need to get in the chute, bud.
You're black with a star. Oh, your eye is enlarged. Black. No tattoo. Not branded. You can.
Do you want me to hold off? Since we only have a select amount.
We can, I guess, go get more if we need to. I don't suspect he's in great health, but I'll listen to him. Oh, buddy, your skin. Poor guy. Heart and lungs on this side sound good.
Something that doesn't have.
If he has no teeth.
Well, he has teeth. He just doesn't have those teeth.
Like incisors? Can I see? Can I get you back up? Thank you. Good boy. Oop. You're very long in the tooth. But you don't look like you're that old for... Cups are gone. So you'd be between 6 and 7 based on your teeth, but you look way older than that.
10.
Well, based on the wear of the middle incisors and not having a hook, even though he doesn't really have much of an I3 on that side. Let's see what your teeth look like on the other side. got swelling around your teeth on this side. But your incisors aren't very big.
Do you want to call him 8?
I would think he'd be closer to 7, but he doesn't have the hook. But that eye is swollen on that side, for sure. It's definitely bigger than this one.
He's got a lot of dry, flaky skin.
But I want this that blocked the drainage angle, then that would cause his glaucoma.
Please don't have lice. That would not.
His skin doesn't look great, so he might have lice. Just be careful.
What was your initial
Yes, please.
assessment of him?
He's on the younger side despite how terrible he looks. He obviously has some scars from some traumatic events in his life as early as he is, and he's also really painful over his back. So we're going to make sure he doesn't have anything that would cause quality of life to be really poor for him as young as he is. So we're concerned about that. But hopefully if there's nothing major that we can find, we can get some farrier work and nurse him back to health, and then hopefully he can be adoptable.
The babies with the really bad legs, they're on some really heavy-duty pain medicine right now. And they're just hanging out and eating some food. And this one went ahead and laid down. And the condition of their legs is just so, so horrific.
Yummy, oh, good boy.
So we're going to be getting some x-rays on this horse to see what's going on inside. He's pretty skinny, poor guy.
There, you look like you're a good nugget, so I'm gonna put this in place. Good boy, don't move. We don't want your foot. No, I don't want your foot. That is very weird looking.
You see anything?
Is that extra spacing?
It could be a little oblique, so we might need to put him up on a block to see, but nothing overly. You get a lot of stuff on your skin.
Is he resting?
But no, I can try and get a little bit less oblique.
It's a really pronounced line on his hip there.
Yeah.
Nutrition change or something else?
Looks like he had a traumatic wound. But I don't see anything bony. We could do a DP too.
Anytime horses come off the truck, we're really busy. We have 2 Percheron babies that are really sad. And sadly, we keep getting these babies from this trader that are in the very same or similar condition, and it's like genetic. So he gets a lot of horses from the Amish. So we believe that there is a stallion that, and could be mares too, but they all look the same. They all have these same problems. So we think that, I mean, there could be several stallions from original sire that had problems, and these babies are just born deformed, and they are dumped into the slaughter pipeline. And it's probably some potentially Amish family that has all these horses they're breeding, and they're like, oh yay, we got one that's normal, and tons that are not.
In addition to everything else, come to find out, Haley's a farrier. Who knew?
Yeah.
I guess we could see your foot.
Yeah. He does have some stuff there, but let's see if it's on the DP. Now that his foot's been picked out, we'll know what's truly there and what's truly not. Actually, it needs to be behind. He's like, what is that?
Why'd you have to move? It's a board.
Let's see if we got anything. We got some teeth.
Oh yeah.
They look pretty good.
Oh yeah.
Yeah, you got a lot of teeth, so you're definitely younger.
Lots of root.
It's called using your head, really, is what it comes
Right.
down to.
Literally.
I gotta get an image that way. Come on. Yeah. What's going on with the top of your scapula? Looks very moth-eaten.
So what did you see on the x-rays with this guy?
Sure. So there is a pretty significant soft tissue opacity where that wound was. That's healed on his right front on the heel bulb. There is some opacity changes to the bone, but it's hard to know if that's because his skin has a lot of stuff on it. So we're gonna put him out in the pasture and give him all the things and just kind of give him time to decompress and reevaluate his pain level next week. But everything we saw on the radiographs were pretty mild, so.
And did x-rays confirm that he's young?
Yes, we took x-rays of his teeth and he has lots of tooth left. So he definitely is on the younger side of things like we thought.
All right, Dr. Jean is checking horse number 2. Cute little face. Checking heart sounds, lung sounds, all that good stuff. Meanwhile, Caitlin's giving wormer and probiotics and whatever else we give these days. And apparently it doesn't taste very good. Ugh. Slimies.
Drooling on me.
So this horse laid down and then went completely flat down and isn't doing very well. So we're going to stop all the other assessments and intake and give this one the help that he needs.
Don't kick me. Look out behind you, Jordan. Yes, it's a mare. Ugh.
Poor horse. So, it's not normal for a horse to lay down in this situation because they're not comfortable. It's not a peace thing. It's
What's it called?
I can't stay standing, and that's really concerning.
That you can see in their mouth when they're like 7?
It's like a 5 to 6 out of 6 heart murmur. Hi, baby. And her heart rate's elevated, so she is painful. Yeah, it's like whoosh, whoosh, whoosh.
She's a sweet man.
Poor ma'am. I'm sorry, sweetie. Oh, baby, you're just skin and bones. So that signals she's getting one. Yeah, signals endotoxemia, so there's something in her gut or her body that is releasing endotoxin. Poor ma'am. Excuse me, I'm sorry. I'm sorry, Miss Ma'am. We're gonna get you some pain meds though.
So this is a tattooed thoroughbred, and we looked up her tattoo, and she was born in 2004, so she's only 20 years old, and her name is Classic Mirage, and it's just, at 20 years old, just completely wasted away, just no food, no adequate nutrition, and somebody chose to do this to her, and it's just so horribly sad and infuriating all at the same time. Like, all it takes is food. Only 20. This is what the slaughter pipeline does to horses.
So this lovely thoroughbred mare, when we looked up her tattoo, she's called Classic Mirage. She's about 20 years old based on all the information about her at the Jockey Club. She came off the trailer okay, but she went down and we asked her to get back up after she had some pain management and she just couldn't. Her heart rate is elevated. She has a pretty significant heart murmur. Her gut sounds are decreased. I think she's already kind of given up. But once we gave her the pain management medicine, she was much more comfortable and actually nickered and whinnied and stuff, and she was real sweet. But she's already developing a toxic line, so her body's already breaking down. So the best thing we could do for her is give her a last act of kindness.
And so this is the next horse that we're working on. Beautiful, beautiful horse.
Why is this one the one that you have to beep on? Yeah, she had some pretty significant arthritis. All of her joints are collapsed or ankylosed down. This is the lateral. You can see up there on that calcaneus. That's got some changes there. So
she's living in chronic pain.
Arthritic pain, but we have joint injections we can try that we're doing on the other horses and see, because we already have it in stock, we can give it to her. But it doesn't look septic or anything like that. It's just old arthritis.
This is a 20-year-old, and Dr. Gina diagnosed her with the help of some x-rays of having some arthritis in her legs, but hopefully it's manageable. And she's going to go out and do her quarantine, and she'll get another recheck. Sometimes horses don't come with beautiful halters, so we take the not beautiful halter off, and we put a pretty red halter on. That's a piece of work right there. Trash can. Definitely trash can.
It looks very scruffy.
You also have a scar on your cornea on that side. Oh, this eye looks sad. You look very goopy.
Oh, we call him Teddy. Oh.
Alrighty, this guy appears to have Cushing's. I'm sure.
That would be my top differential. You okay?
Boogies.
And he seems quite wobbly to me. Like
He is. He also has a sore right there.
Big old sore. Ugh.
Poor guy.
Wait, hold on, let me grab. I'm missing
Oh,
a
we
side.
didn't age his teeth. How old is he by his teeth? I didn't look at him. You don't like your teeth being looked at. You're very old. Well, not very old, but.
What do we think he is?
Horse.
I'm gonna lift up his tail. It looked like his tail. Yeah, he's a Tennessee walking horse.
I'm gonna think he's. You okay?
Wiped on me.
Based on the shape of his teeth, I would think he's probably in his 20s.
So 20s, Tennessee
20,
walking
22,
horse,
22-ish.
cut tail.
Hold on.
Sorry.
Still waiting. Alright, let's catch him.
I don't know if anybody will recognize this guy. He's not wearing a mic, so he can't talk to you. But his name's Corey. Corey got off work at his construction job. He came over here to volunteer to help out.
I was bored, and I figured, it's the hardest day of the month for y'all. Let's see if y'all need help.
They can't hear you, and I just dropped my mic, but now they can hear you.
Yeah. I said I got off of work, and I was a little bored, and just figured that buyout is the hardest week of the month, or day of the month for a lot of people here, so decided I wanted to come help.
And we really appreciate that, Corey. Mercy.
Yeah, she's definitely off in the hind for sure.
You'll just be a pasture pet with that kind of derriere, ma'am. I'm sorry.
I can't believe if somebody tried to breed you like that. That must have been super painful, ma'am.
So this horse is named Ballantine, and she's 19 years old.
Sorry, I gotta get all up in your armpit.
What would y'all say that? Yes.
Gonna get an x-ray. She's got weird something going on with her tail. It's broken or something very abnormal. So gonna get an x-ray, see what it looks like on the inside. And of course Tawny's getting pictures of everybody for Facebook.
I'm gonna be so excited when we get that barn down there, the quarantine expansion. Because taking photos here is very difficult because the light behind here and the horses like turn into silhouettes. So that's another plus for this barn that's getting built.
The funky bit.
You want to just follow it like this?
Yeah. We'll see what kind of image we get. It's kind of hard to get this part of the body, but because there's so much muscle in the way, but since she's kind of skinny, I'm hoping it'll help us. See if we got anything worth viewing. Oh, well, let me turn it around. Looks like back here is a little abnormal. Can try shooting a little further caudal. Yeah, like right in here. Ma'am. Let's see. Yeah, that's where the fracture happened. It's all healed, but all that stuff back there is where it happened.
So based on the x-ray, what do you think her future is? And
Based on this, I mean, it's past the point of the back, but everything is connected. So I wouldn't think anybody super heavy could ride her. We'd have to see how she does with a saddle weight on her back, but she had a pretty traumatic fracture that has already healed. It's pretty old, but that's a pretty significant change to the vertebrae that are past the sacrum and the pelvic area. So we'll have to talk as a group and see if she's adoptable with this history, but she's comfortable for now, just standing here, but whether or not she could carry any weight on her back, I don't know until that happens.
this horse has a protruding spine. Dr. Gina had a fancy term for it that's medically accurate, but she's...
Split S1 sound. That can be normal in an athletic horse. But you don't look too athletic, unfortunately for you. Your poor back. I wonder if it was a traumatic event since this horse she's 19, right? She lived quite a while.
Hold on, I've got to listen to your other side.
Dr. Gina, what did you call this, the spine coming out?
Kyphosis or kyphosis. It's when the spine does like that and then...
Kyphordosis,
Sorry.
something like that. So, yeah.
Sorry.
Kyphordosis.
Kyphosis.
I would just, and then do it again.
Okay. I'll write it down later.
Oh dear.
Could be an abscess or could be an old healed fracture. Is it itchy? No, not itchy.
Like a dog.
No.
Like you look. Get this woman away from me. Yeah, she's giving us a look right now.
Well, the next horse came out of the stall instead of out of the squeeze chute. But I know I saw Tawny taking pictures and stuff, so. Pretty horse. Very, very pretty. This is how we stick the tags on now. Looks pretty cool. And there you have it, 19-year-old standard bred mare.
I hated that her knee looks horrible.
Getting the x-ray all set up.
Yeah. Right front carpus. We have a right to boop the snoots.
So there is one tube that will need to be like relabeled.
Okay. You're okay. Does that hurt?
She probably thought I was a flat.
Let's see what it looks like.
Fingers crossed.
That's horrible.
Yeah.
We can do DP also, but yeah, that looks
Chica.
pretty. Is your accessory carpal bone broken? Ooh.
Damn.
That would explain the chronicity look of her other foot being all pancakey. I'm probably oblique to your actual true orientation of your carpus. Ooh. Yeah. That looks pretty gnarly. It's very collapsed. So yeah, you had a fracture at one point with the way that that bone is not, the bony column is not straight anymore. So yeah. Darn it, woman. Looks pretty gnarly, ma'am. Yep. There's a gas opacity in there too. Lovely.
So chronic pain, is that what's...
More than likely, yeah. It looked like at one point she had a pretty gnarly fracture in that carpus. It's no longer hot or super, super painful, but yeah. That is, her bony column is no longer straight like it's supposed to be. It's really collapsed on one side. So that would definitely, quality of life wise, would be very painful over time. Poor ma'am. And we can give pain management, but those are not benign in and of themselves. They can cause pretty significant kidney and liver damage if they're given long term and not monitored very well. So unfortunately for her, probably last act of kindness is going to be the best thing we can do. She's very sweet.
So they're going to be getting an x-ray of this hole in the side of this horse's head. And hopefully there's nothing too major about it.
All right, sir, this won't hurt you, I promise.
But Dr. Gina keeps having to lift this x-ray machine up high.
Yeah,
And
because I am a munchkin.
and it seems like we got mostly all tall horses today.
Yeah.
In fact, no donkeys, minis.
Anything?
Yeah, you can see the particulate from the discharge in there.
Oh, that's leaf rope.
I can try going a little further and see. It looks like it might go down between his cheeks.
Maybe he got stabbed with a toothpick. He's got a bumpy right there.
So what are you thinking?
Yeah, he might have been hurt because he doesn't have any feelings of like,
Strangles.
yeah.
So what are you thinking, Dr. Gina?
Looks like he had a blown out abscess. So I don't know what exactly caused it, if it was like a traumatic penetrating wound or if another horse did something to him. But it doesn't look like it's really involved too far cranially or into his guttural pouches. And it doesn't look like any part of his cervical spine is involved, so it's just localized to right here. So I can finish his exam and see if I find anything else. If that's all he's got, we can just give him some Exceed, maybe give him a few days, recheck him next week. But let me see what else we have, if there's anything else to find. Thank you, Emily and Jordan. He is 23. He's of poor body condition. To see what his teeth look like, to see if he could even make it through winter. I'm worried about his body condition and his ability to actually gain weight with the winter coming. And that massive wound on his neck.
Little warning, this horse has a wound that is horrible. Like, absolutely horrible. And yeah, horrible, horrible wound. And he decided to turn around. That's easy, baby. All right, after a little bit of chaos, he's up and out here. His wound is really bad, and Dr. Gina's gonna have to look at it a little bit more. But yeah, it was a little bit scary. He got himself turned around, casting the chute, had to open it up, and I was doing the physical stuff, so I couldn't be filming, but he's okay, other than his horrible leg wound. The paint, unfortunately, can't be saved with the horrible leg injury. That's medically, with a reactive behavior, and that injury is so severe, even if it was a perfect saint of a horse, probably couldn't be treated. So I have to say goodbye to the paint with a horrible leg injury. The transporter said he actually had seen that horse a week earlier, and it was still in that condition. This horse had been in the slaughter pipeline, not the one we're looking at, but the paint with the horrible leg, had been in the slaughter pipeline for at least a week, and no veterinarian care. Like, how are people allowed to neglect veterinarian care in such an emergency situation like that? How can a sale ring allow that to be sold through their sale? I I don't even understand it.
I'm sorry, Miss Ma'am.
This horse is pretty. Skinny,
Just based
but
off
pretty.
the look of it, I don't know.
Well, Corey got a halter on her. And is that a boy or girl?
It's a mare.
It's a mare. Yep, Corey got a halter on her, and she seems to be well halter trained, so that's really wonderful.
Maybe she's just skinny.
Maybe she's just skinny, Tawny says. Maybe.
Day 1 of intake, we got through quite a few of the horses, not all of them. Tawny is going to go through the rest and get their numbers assigned and their pictures and everything like that. We got through the most criticals, the ones that really needed our help today to ease them of their pain. We have a few that are ready to go in the 10 acre, which they're going to film that later, which we're really excited about. But we got a lot of older horses that are like 19, 20, so I don't know if they just went through their barn and like, who all's met their miles? We're going to get rid of them kind of a thing. So there are a few that have a lot of old injuries and things like that that we're going to probably get to tomorrow, but they're all stable and fine and seem comfortable for today. So we're going to give them lots of hay and water, time overnight to decompress, and come back at it again tomorrow, and hopefully with Dr. Lydia. So we really missed her today. She's awesome. We love her so much.
So where is Dr. Lydia?
She went on a project. I don't know how much they want me to divulge before they interview her, but she went on a project to California that might end up being really exciting for us here at Horse Plus. So hopefully she comes back with lots of goodies and information. So I'm looking forward to talking to her and seeing what she did. So